Welcome back from lunch, and I hope you are able to make some new connections. Kelly and I now have the privilege of honoring 4 Iowans who have made great strides in reducing the burden of cancer. Our first award is the Iowa Cancer Champion Award. This award is given annually to an individual or organization that has demonstrated a commitment to reducing the burden of cancer in Iowa through work on policy, systems, and environmental change. This year's winners were nominated by Lori Mott, who wrote, "On behalf of Unity Point Clinic, it is my honor to nominate Dr. Holly Bermel, Family Physician and Medical Director of Quality and Population Health, along with Katie Goldberg, RN, Manager of Quality and Population Health, for their time and efforts spent on ensuring our patients are screened for colorectal cancer. Due to the shortage of specialists and access limitations, Dr. Bermel and Katie worked with Exact Sciences to think outside the box when it comes to screening patients who are eligible to receive Cologuard kits. The automation aspect of this work allowed our GI providers to focus on the high-priority patients who need a diagnostic workup while allowing routine screening for our qualifying patients to complete the Cologuard kits in the comfort of their home with minimal time off from work. They work through various policies and systems as they strive to ensure their commitment to quality and population health. Their collaborative efforts have reduced the workload on our care teams and improved patient outcomes. Because of their efforts since July 2023, nearly 8,000 Cologuard kits have been mailed to patients. Over 2,000 kits have been completed and sent back with valid results. 183 positive results have been identified and followed up with. Congratulations, Holly and Katie.
Thank you so much for this award. This project idea really stemmed out of the pandemic when I first entered my role as the medical director of quality, and patients weren't coming into the clinics, and due to the Great Resignation, we had a hard time with staffing shortages to find out ways to get this work done. And so, again, we tried to think of how can we do this from a population health perspective. And really, patients don't need an appointment to get their colon cancer screening done if they are average risk. And so the pandemic really did kind of open the doors for at-home screening. Patients could do their COVID test and we could get their Paxlovid if they were due. And so they were used to and liked home testing. And so, again, partnered with Exact Sciences, got these kits out to our average risk patients and had pretty good success with getting them back. We started with people who were due for rescreens and then started to tackle our 45 to 49-year-olds with the change in guidelines. So hope to continue this work. Thank you.
So much. Congratulations. All right. It makes me so happy to give this second award today. This award is called the Spirit of Collaboration Award, and it is given annually to a member of the Iowa Cancer Consortium with an outstanding commitment to collaborative cancer control efforts in Iowa. This year's winner was actually nominated by the consortium staff, and in our nomination, we wrote, "It is our honor to nominate the incomparable Katie Jones for the 2024 Spirit of Collaboration Award. Many consortium members may not know that Katie's cancer control career stretches back to her days as an MPH student at the Iowa Cancer Consortium about 15 years ago. And bonus points to people who can name all of the very young people in these pictures. Up here, we had fun going through and looking for those. After some detours into local public health and the state diabetes program, Katie thankfully found her way back to cancer control. She now serves as the program manager for the Iowa Health and Human Services Comprehensive Cancer Control Program. Katie is one of the truest advocates for collaborative cancer control and the consortium itself. and to think of the quantity and quality of partnerships Katie has developed and nurtured in her time is astounding. It's easy for our team, the consortium staff, to forget that Katie is not one of our own. She is a trusted colleague, partner, and sounding board when thinking through new opportunities, interests from members, and challenges in the cancer control environment. Whether she's leading part of the Iowa Cancer Plan revision, providing technical assistance to survivorship grant recipients, introducing community members to the network, chairing the Quality of Life work group, or supporting clinics and improving quality metrics for HPV vaccinations, Katie leads with and embodies the spirit of collaboration. Katie also enhances Iowa's cancer control reputation and partnerships nationally. She elevates Iowa's work as a frequent speaker and panelist at national webinars and meetings, and as a representative on national boards and committees. For example, she currently chairs the Cancer Council of the National Association of Chronic Disease Directors. Our team frequently connects with Comprehensive Cancer Control Coalition staff in other states to problem solve and learn from each other. Discussion often turns to the coalition's relationship with the state comp cancer program. Unfortunately, in many states, this is a complex and often strained relationship. Here in Iowa, however, we are so proud of and grateful for the relationship between state-level cancer control partners, including the consortium in the Comprehensive Cancer Control Program at Iowa HHS. Katie is a huge reason for that, and cancer control in Iowa is certainly stronger because of it. Despite her critical role in cancer control in Iowa, Katie is often behind the scenes and the unsung hero. We hope that through this award, we'll be able to publicly and enthusiastically celebrate Katie's impressive and irreplaceable spirit of collaboration. Congratulations, Katie.
Thanks. Do you want to say something?
Do if that's okay.
Yeah, do you want to do a picture first?
Okay, here's the word.
We got it.
Thanks, you guys. Thank you so much to the amazing Iowa Cancer Consortium staff and the board of directors for this award. I am honored to receive this. I feel so fortunate every day that I have the privilege of getting to work collaboratively with so many passionate, incredible, and brilliant people, including Kelly Wells-Sittig, Rachel Schramm, Liz Orton, Kelly Rollins, and the rest of the consortium crew, my colleagues at Iowa HHS, including Jill, Haley, Denise, Jean, Victoria, Gina, Randy, many others, and the experts at the Iowa Cancer Registry and the University of Iowa, including Dr. Charlton, Dr. Nash, Dr. Askelson, and Dr. Weiner, Shelley Walker with the American Cancer Society, many other partners, Dr. Deming, too many to list here, and of course, all of the many healthcare providers, cancer survivors, and volunteers who have dedicated their time and energy to reduce the terrible burden of cancer in Iowa. I have gotten to see how a lot of other states' cancer programs and cancer coalitions work, and I am not exaggerating when I say I think we have the best cancer coalition in the country here with the Iowa Cancer Consortium. Thank you again so much.
Okay. Our final award this year is the George Weiner Cancer Control Visionary Award. This award is named after Dr. George Weiner, inaugural and long-term president of the Iowa Cancer Consortium and director emeritus of the University of Iowa Healthcare Holding Comprehensive Cancer Center. In those roles, Dr. Weiner was dedicated to assuring the two organizations work together on their shared vision and mission of reducing the burden of cancer for the people of Iowa. The George Weiner Visionary Award was established on completion of his term as Iowa Cancer Consortium president to recognize an individual who has kept their sights on their long-term big picture goal and worked tirelessly to achieve their desired outcome in cancer control. Can you change this slide?
Oh, no, you're okay.
Okay. Okay. So slide change.
Yeah.
Okay. I'm very concrete with my instructions here. It is with deep gratitude and respect that we present this award posthumously to Dr. Bill Field. It's a tough one. The nomination from Denise Attard-Sacco at Iowa HHS, Julie Weishar at the Energy Association of Iowa Schools, and the Iowa Cancer Consortium staff. They wrote, Dr. William Field, who insisted everyone call him Bill, always began any presentation with these words, "Statistics are human beings with the tears wiped away." The quote is from Dr. Irving Slakekoff, one of the loudest voices against asbestos in the 1960s. Bill dedicated his career to another naturally occurring carcinogen, radon, and the quote perfectly captures how he was an empathetic human first and a world-renowned researcher second. Bill said his fascination with radiation began at a young age. Growing up in Pennsylvania, he received routine chest x-rays as a newborn, radiation for an enlarged thymus, and head x-rays to diagnose chronic ear infections. Even as a 10-year-old, he wondered what the radiation might do to him. Living near the 3 Mile Island nuclear plant in Pennsylvania at the time of the 1979 accident, Bill measured radioactive iodine levels in the thyroids of meadow voles trapped in the vicinity of the power plant during a 10-day window following the accident and showed the utility of meadow voles to monitor radioactive iodine contamination into the ecosystem. The work led to his master's degree and first scientific publication in health physics. After working as a health physicist at the University of California, Berkeley, and suffering a work-related injury during a dangerous accident with a mixture of chemicals, Bill moved to Iowa, where his wife, Liz Field, received an appointment at the University of Iowa. Bill got his PhD, and his dissertation was on radium and radon levels in Iowa well water samples. In 1993, Dr. Charles Lynch, my mentor and former director of the Cancer Registry at the University of Iowa College of Public Health, recruited Bill to coordinate the Iowa Radon Lung Cancer Study, thought to be one of the most comprehensive residential radon studies ever conducted. Bill went on to publish dozens of peer-reviewed articles about radon, articles that have been cited thousands of times in subsequent publications. His work primarily focused on radon and lung cancer, but in recent years he worked with researchers at Columbia University to study the neurological effects of radon, including stroke. Bill was passionate about educating healthcare providers on the dangers of radon and the importance of asking their patients if they've ever tested their homes. The majority of Bill's career was spent at the University of Iowa College of Public Health, where he founded the Occupational Epidemiology Training Program. He served on the EPA Science Advisory Board and Radiation Advisory Committee, and he was a presidential appointee on the CDC NIOSH Advisory Board on Radiation and Worker Health. He was very active with the American Association of Radon Scientists and Technologists, or AARST, with many calling him a giant in the field. Dr. Field was awarded the Iowa Cancer Champion Award in 2017 and the Conference for Radiation Control Program Directors Radon Hero Award in 2022. Bill was a friend and fellow advocate of Gail Orcutt, a retired teacher diagnosed with stage 4 lung cancer due to radon. Bill was active with the Iowa Radon Coalition and later the Iowa Cancer Consortium Radon Work Group. He was a longtime consortium member and a dear friend to so many of us. His research, advocacy, and expertise eventually helped lead to the passing of the Gail Orcutt School Radon Safety Bill in May of 2022. Bill was a thyroid cancer survivor and passed away from refractory mantle cell lymphoma on November 4th, 2022, at the age of 68. Accepting the award on behalf of Bill are his wife, Liz, 2 of his 3 children, Katie Reesner and David Field. Come on up.
Thank you very much. If Bill were here, he would certainly thank Denise and Julie and the Iowa Cancer Consortium staff for the nomination. And probably would say he would also thank people in the audience, because many of you who knew Bill, this was like a collaboration, a two-way street. You have inspired him as much as he has inspired you. He really upheld the principle of collaboration and community. And as we all know, to conquer something like cancer, it takes a community to do that. It takes people seeing patients. It takes patient advocates for sure. And it does take people like Gail Orkart, who really touch our hearts, to work tirelessly to get some legislation passed so that there can be public legislation to prevent exposure to things like radon. So I just want to congratulate all of you in the audience who participate in how you personally fight against cancer. So thank you.